Today, I'm honored to share one of our team members will be sharing a little bit more about our research and what this might mean for communities that you are working with as well. And with that, Kelly Chandler is an assistant professor in human development and family sciences at Oregon State University. She's been a member of the Rural Families Speak About Health and Resilience multi-state team and is the co-PI for Oregon since 2016. She applies a work-family justice lens to study how conditions, workplace culture, and work-family policies affect the health and daily lives of employees and their families. And she also examines the implications of this work for family processes, including emotional transmission, family routines, and parental socialization. So we're really excited to have a little bit here to hear from Kelly. After we hear from Kelly, we'll break out into breakout rooms where we'll have an opportunity to discuss more of the question that was posed to you today in your reminder email to join, and then have the opportunity after this webinar to share some of that information back with you as well. So we hope is a continued conversation. This is a second in our webinar series. Hopefully some of you were able to join the first, and we look forward to you joining future presentations. Without further ado, though, I will turn it over to you, Kelly, to share your screen and share your information with us.
Wonderful. Well, hello, everyone. It's great to see such a great turnout, and I'm really thankful for the opportunity to share some research from this project and to learn from you all. So I really see my role as just kind of sharing a few highlights, but hopefully that will ignite some ideas and have a lively discussion afterwards. All right. And I apologize for the technical difficulties I had earlier, so fingers crossed all goes smoothly. Let's see. Yeah, it's asking me who can share. It's not letting me share. Oh, I'm the host now. Okay, I have the power. Nope, I don't.
Apologies for the technical difficulties.
I'm sure you all are used to this by now, right?
I am not seeing an option to share. So Kelly, I'm going to ask you to send me your presentation and I can share that for you.
Sweet. Happy to do that. Well, as I'm doing this, I'll kind of multitask. I'll just share a little personal experience that I'm a mother of experience, the challenges of managing work and family responsibilities. Today I'll focus on the research, but it definitely gives me some insight. It's not going to let me send it to you, of course, so I'm going to post it on Box for you. It's funny, people ask me, okay, so you study work and family and how to reduce work-family conflict, so don't you have it all figured out? And no, I don't. That's why I research it. Let's see. All right. So first, I want to acknowledge NIFA for funding this webinar, and of course, I'm very grateful to be able to join this multi-state research project on individual, family, and community factors associated with resilience in diverse, rural, low-income families. Next. All right, so let's start with the big picture. Of course, it's undeniable that we are living in uncertain times. There are a host of reasons contributing to this uncertainty. including the housing crisis, climate change, racial injustice, childcare deserts, job insecurity, healthcare crisis, and the list goes on and on. And of course, the COVID pandemic has turned our worlds upside down. And COVID has exacerbated many existing challenges of working parents across the US. And I think sort of, although devastating, one, I don't know if you want to call it a benefit, but it definitely has put a spotlight on how incompatible work and family roles can be during this pandemic. So I hope that this continues to spur policy and program discussions about how to really help families manage both work and family responsibilities. Next. Parenting and working during the COVID-19 pandemic. So this picture captures a lot of the chaos and uncertainty, and of course it's changed from the stay-at-home mandates and even today, but there's still a lot of uncertainty and sort of this fear of the unknown, with feeling risk for the health and well-being of loved ones, making sure folks are vaccinated and wearing their masks properly, potential for quarantining after travel, or if there's an exposure at school, managing childcare, which we'll talk a little bit about later, and how to manage work and family responsibilities if there's another stay-at-home mandate, right? So there's still this continuing uncertainty, and things just keep evolving, right? There's new changes, new mandates, new guidelines at work, or in schools or childcare that can be particularly stressful for families. And so in this webinar, of course, as you know, we'll be discussing what parenting and working during the COVID-19 pandemic has been like for rural low-income families. Next. Before that, yeah. So specifically, this webinar has 3 goals. There we go. So briefly highlighting the unique experiences of parenting and working in rural low-income families. And this is really showcasing some of the research that this team has done. When I say this team, I mean those involved in the rural families speak about health and resilience. And touch a little bit on the challenges of parenting and working during this pandemic, focused on rural communities. Of course, you all are on the ground working in communities, so there's a lot for you to discuss and share with one another, but I'll just highlight a few. And this is, and the third one is really to share successful work-family strategies with peer professionals, with each other, to build a collective outreach capacity. Next. All right, so as I said, I'm just going to highlight a few findings from over 20 years of research by many of the folks here in this webinar, including Yoshia Sana, who's done a lot on employment in rural low-income families. I have a picture of a book here, Rural Families and Work, that captures a lot of the research from this team on this topic. And I've listed a few employment conditions, stressors that are characteristic of employment for rural low-income families. So jobs in limited industries, few employee benefits that really facilitate being able to manage work and family, underemployment, job volatility, intermittent employment, and then the last 3 that I have bolded, I'm going to share some vignettes from this research focused on low wages, non-standard or unpredictable work schedules, and seasonal work. Next. All right. So in a paper I co-authored with Carolyn Bird, Ann Berry, and Brenda Vera, we captured some of the realities of some rural low-income mothers and their experiences with trying to manage work and family responsibilities. And just to be assured, these are pseudonyms, so we're protecting the confidentiality of the mothers who participated in this study. So first we'll talk about Maybeth's reality, and that is that rural jobs limit economic self-sufficiency. Maybeth was a self-employed married mother of 5 who worked part-time as a barber. She worked only when her husband was off work to watch the children due to the prohibitive cost of childcare. Even with the additional income from her part-time job, Maybeth's family struggled to pay for their basic needs. Although rural low-income mothers who participated in this project, this study, they worked, the types of jobs did not enable many mothers to meet their family's economic needs. Next. All right, Lucy's reality. So Lucy is a single mother of 1, and she was a manager at a fast food restaurant at the time of this interview. Lucy and her young daughter lived with Lucy's grandmother, who provided childcare while Lucy worked. Lucy explained how her constantly fluctuating work schedule made it difficult to spend time with her daughter and also get enough sleep. Lucy's experience demonstrates that many mothers are faced with difficult decisions when managing fluctuating work schedules and needing to care for their children and meet family responsibilities. Without set schedules, mothers may need to constantly patch together care for their children, including something called tag team parenting with another parent or caregiver, where one person works and then while the other one stays home, and then they sort of pass the baton, so to speak, in terms of caregiving responsibilities. Of course, continually having to arrange for childcare due to these non-standard work schedules can take a toll on the well-being of mothers and other caregivers, the children, and their relationships. Next. All right, last is Gloria's reality. Seasonal work causes financial instability. Some of the participants in this study had husbands with seasonal work, which is common in rural communities, as I'm sure you all know, making the family budget during the winter months especially tight for seasonal work. Gloria, a married mother of 3, explained that although she worked full-time year-round, her husband was laid off from his construction job every winter. To compensate for lost income, she worked extra hours in the winter. Despite Gloria's additional work efforts, the seasonal loss of income challenged the family's food security, prompting reliance on the local food bank during the winter months. Gloria's reality and other mothers' similar realities that we found in this study was to have a burden of striving to make up hours that are lost during the off-season. But despite their efforts, they may be unable to recover that lost income. Next. Okay, so that's just highlighting some research from this study pre-pandemic, but we can see how some of the challenges that rural low-income families experience can be exacerbated during the pandemic, which we'll talk about. So as is typical, I would say there's been less research and attention to rural families and communities during the pandemic. I'd love to hear your thoughts about that. And as this title from the Center for American Progress says, rural America has been forgotten during the coronavirus crisis. So how have rural families been faring during the pandemic? How have they navigated work and family responsibilities? Again, I'll share a little bit of research, but really want to hear from you folks to be able to share your experiences. Next. All right. So rural families have had more and/or unique challenges during the pandemic compared to families in urban or metro areas. And as I said, many of these challenges existed before the pandemic were definitely exacerbated. So let's start with health. So health of rural families has been at greater risk during the pandemic. Rural Americans are more vulnerable to severe illness or death from COVID-19 than urban residents due to underlying health problems, typically older age residents or community residents, and lack of health insurance. And important to note is that COVID-19 rates have been particularly higher people of color, including Latinx. And unfortunately, these rates of COVID infections are still going up in rural communities. And there are some great efforts. I've heard about an extension of increasing those vaccination rates, in particular within the Latinx population. But these infections rates are going up, as well as increased death or severe illness due to lower vaccination rates. What's particularly troubling, if that's not troubling enough, is how limited there is in terms of healthcare and intensive care units. I'm sure you've heard in the news just the unfortunate limited number of even beds in hospitals. But combine the limited healthcare in rural communities, as well as the distance that folks have to travel just to get to have their healthcare needs met. And this gives pause in terms of thinking about parents who are in the sandwich generation that are employed, they're caring for their children, but also caring for their aging parent. And so concern for their parents' health also, and the long distance to healthcare facilities can make this particularly stressful. Employment. The experiences that I shared of the three mothers highlight some employment-related challenges for rural low-income families during the pandemic. So if you'll recall, totally okay if you don't, but Maybeth, so in the beginning of the pandemic, barbers and those with similar occupations were unable to work due to stay-at-home mandates, which affected their income, right? So Maybeth was a barber and likely was, if she still has this job, would have been affected by the stay-at-home mandates. And of course, there's still uncertainty around whether businesses may close again and that people may be out of work. And there are already limited jobs in rural communities, so other employment options when businesses close or open at limited capacity may be scarce. Now Lucy, she had a service industry job. She was a restaurant manager, which at the beginning of the pandemic would have been closed and then opened at limited capacity. Service industry jobs are common in rural communities, which can put employees at risk as they are serving customers and can create stress about putting children and other family members' health at risk. Jobs like these in the service industry are obviously not conducive to remote work, which many privileged parents, including myself, were able to have and continue to have. And of course, remote work limits exposure. Some would argue it increases work-family balance or fit, but it certainly can also create some conflict as well with those blurred boundaries there. And if you'll recall, Gloria's husband had seasonal work. And important to note is that many seasonal jobs have had high rates of COVID-19 transmission, which is an additional stressor to families. And also note that transmission is higher in some industries like farming and meat packing in rural counties. I know that there was a business that closed due to COVID exposure here in Oregon. Third is childcare. Maybeth's reality. So in the context of childcare, remember she had difficulty with, well, first the cost of childcare. So there's, the affordability, the availability, and of course the quality of that. But as you all probably know, childcare availability is even more scarce as many centers have closed, never reopened, may still have limited slots, or are currently understaffed. And of course, there still is that risk of exposure and the uncertainty around that. Limited transportation, and also limited or spotty broadband access. So of course, with the stay-at-home mandate, kids were doing school from home, which without that Wi-Fi or broadband access could make attending school stressful or challenging, or maybe not even possible. And some children still may be doing school remotely or in a hybrid mode, making internet access so much more important. And for those folks that are able to work remotely or have permission to, obviously limited internet also will affect that work. For the breakout sessions, which we'll get to in a second, would really be great to hear about share about the challenges that you've seen in your communities, and the ideas and the solutions that you've had to help families. For example, how are you considering health risks to aging rural community members while balancing desires to be in person? So how do you really create that connection? How are you promoting access to broadband? How are you providing flexible outreach when parents may have challenges meeting outreach times related to transportation, childcare, work schedules, or other challenges? Next. All right. So in the conversations today, I want to wrap up because we started late due to technical difficulties, which, you can never predict those things. So I just want to wrap up and just sort of maybe spark some ideas that you all can share, thinking about how can we foster resilience in rural low-income families in times of uncertainty, especially in terms of helping manage working and parenting and the challenges that can come with that. So thinking about what sort of resources can foster self-care or self-compassion that is related to, just managing work and family expectations and responsibilities. And, there's this constant pressure of feeling like you have to do it all. And when things are just sort of up in the air, trying to schedule and do things as best as folks can. Also, resources to foster intentional, honest conversations between parents and children about, yes, we're living in this time of uncertainty. Here's what we know, here's what we don't know, but in a way that's developmentally appropriate and honest, but minimizing the potential anxiety or stress that can be around that conversation. And family support networks. And finally, creative solutions for work-family fit, which is the term I prefer, or work-family balance, which is a common term that's used. So I'm going to stop now so that you all have plenty of time to discuss, and thank you for your time. I appreciate it.
Thanks so much, Kelly, for sharing those great insights and things that we all, I think, can keep in mind as we're working in these communities.